What's up, guys? John here, Titan Talk Tuesday, pre-Memorial Day weekend, man. Gotta love it. So it's just awesome. Glad to be here on this Tuesday. It's been a good week so far. I mean, it is what it is. I appreciate it, guys. I hope everybody's week has been good too as well. A lot of things going on. What up, Eric? How you guys doing, guys? Big Drew's in the house. We have to get Big Drew on here, do a Titan Talk with us. Hopefully here in June. Big things coming for us. Big things coming for Titan, so I'm really, really excited. So, to start the Titan Talk, let's get into the therapy of the week. Everybody really asks me about questions like this. Hey, John, how do you get over injuries? How can be preventative injuries? What do you do? How do you do it? So, let's talk about BPC 157 first. So, BPC 157 is our therapy of the week. If you guys don't know what it is, DECA is a whole different thing, all right? That's another antibiotic. So, let's do this. So, BPC 157 is a healing peptide. BPC 157 stands for Body Protection Compound, okay? And it's from the gastric juices in our stomach. It's actually a sequence of 15 amino acids. That's all it is. It's really crazy. You sequence those amino acids in different ways, and you will get different effects in the body, which is very, very cool because our body's made up of amino acids. They're building blocks of protein, and they can do a lot of different things. So, putting these things in that sequence is the way that this works and the way that it helps heal the body. And it helps heal the body in a lot of different ways. So BPC 157 is from the gastric juice in the body. So it's in small amounts. And at that point, it's helped for like ulcers. It will help with Crohn's disease in a lot of different ways. Irritable bowel syndrome. There's a lot of different things that they use BPC 157 for. So at that point, it's also good for like wound healing, right? Tendons, joints, muscles, muscle to bone repair. So there's a lot of different things it can help out with. Shoulder injuries. I've had one bad shoulder injury. Man, it has been horrible. And it's definitely helped me out in a lot of different ways, especially with inflammation too. Just in my lab work today, I can't wait to start with you guys. We're excited for you. The believer just got his lab work done. Have you got your lab work done? And we'll talk about that in a second. Have you used it? Yes, Ricky Rude. I have used BPC 157. Now, we got it like 2 years ago from the pharmacy because that was when, we can't do anything. Every therapy that you guys get or I take comes from a U.S. licensed pharmacy. And the only way that you can get that is prescribed by a doctor. So these come from a U.S. licensed pharmacy. So at that point in time, BPC 157 just came out by itself. I literally just had a bad shoulder injury. I've had sports injuries from before, played baseball, all different types of injuries. So you know how that shoulder pain is too, especially if you're benching a lot and stuff. So at that point, what happened was I couldn't even push a 25-pound weight, and I used BPC 157, and I literally documented the videography of it, the videos, and showing you guys kind of my comeback. And one of those videos was in the newsletter, so that really, really helped me. Now, recently, probably maybe 3 weeks ago, I re-injured the shoulder. Same shoulder, man. I also use BPC 157 for golf elbow and tennis elbow. So that is really, really good. And a lot of people have that. I know a lot of patients have used it specifically for golf elbow and tennis elbow. And that's a really, really common one. Tip for you guys. Get your grip on point. Usually that's a grip problem. I even know that your bands that you're wrapping up with your wraps. Get wraps. If you don't have wraps, I promise you, the way it holds your thumb in place, the way your wrist is, it will definitely help. I have not got it since. So the BPC 157 I've been taking along with TB 500 right now for this shoulder injury. Luckily, everything's getting back to where it needs to be. I'm finally getting in there and moving the weight that I used to move. And I never benched to the heaviest max, right? I think the most I benched was with Drew back in Orlando or Europa. In a while, and that was like 315, and that really isn't. I guess it's a good amount of weight, but being where I was at, I used to bench a lot more, and he's putting up 400 or 500 pounds, making it look like nothing. So at that point, for me though, I just want to get back to where I can lift properly. I'm lifting a good amount of weight. I'm pushing it, and I need to, be able to grow to a certain extent. I don't want to grow real big. I want to make sure that my muscles develop and mature properly. I want to be a certain body fat percentage. I want to look good, feel good, and perform better, and not have to worry about any injuries. So BPC 157 is a lot. They even say it helps with, internal organs and stuff like that. From like Tylenol damage, acetaminophen damage, and stuff like that, ibuprofen. So at that point, it can help in a lot of different ways. BPC 157, if you guys don't know about it, check it out. Please call or text us here, 727-389-3220. We're all very, very knowledgeable about BPC 157. Our medical providers and doctors are very, very knowledgeable about these peptides as well, and it can definitely help you out through a lot of different things. I even have a couple orthopedic surgeons, right, that take this stuff because they don't want to do surgery because they know they do these surgeries on a daily basis. It's a hard recovery time. Sometimes things, it's not the way it used to be. So at that point, this is where this can really help you and possibly help you out from maybe not getting a surgery. And it's a big one. I never would do a surgery unless I absolutely had to, or if it would affect my quality of life. You have to think about those two things because every time you go under, it's a chance. I know people have died from breast augmentations going underneath. So at that point, it's very, very scary. So just, be cautious about this. BPC 157 helped my tennis elbow and wrist wraps definitely help. Eric, you're my man, dude. You were my example there for sure. I mean, it's definitely good. Would you take PT 141 injections, not sublingual? All right, so Ernie's talking about a different peptide. So he's talking about PT 141. That's like our Cupid's candy type deal of what we call it, that therapy. And what it does is it works on the nervous system for libido enhancement and not working on, on your blood, rushing in from like Viagra or Cialis. At that point, it's working on the nervous system. So I would do the injection, I think, over the troche. It just all depends. But, the troche is really, really easier. The rapid dissolver, where they're putting in all three different things, capsules and all different types of things. So at that point, it really is up to you. You can really take that capsule with you and go somewhere, let's say, out and take it when you're out. And with an injection, it's going to be a lot harder to do unless you guys are at a place by yourselves or whatever it may be. So if you're going to do the injection, definitely do the injection. It's going to have a faster transportation rate, higher absorbency for sure. But the PT 141 sublingually or orally has worked pretty well for patients. And we put it with a number of different things. We put it with Cialis. We put it with tadalafil, which is Cialis. We put it with sildenafil, which is Viagra. And at that point, it's worked really, really well with a lot of different patients. Especially with girls and guys, it's a little different where Viagra and Cialis for us, it works rushing the blood down there and basically you have this erection and libido ready to go. For females, it's a little bit different. And our superwomen's, they do some of the similar effect of rushing the blood to the extremities, but adding this PT 141 is supposed to help in a whole different way. So at that point, if you're looking to enhance your libido or enhance your sexual life with your partner, check out Cupid's Candy or PT 141. Our girls also know about that. Really cool, man. These peptides are really taking over. I was just at the A4M a couple days ago, and at that point, they're introducing so many new therapies. We're going to be having a lot of these different therapies coming out, but they're really, really cool, and they can help in a lot of different ways, and they're not hormone-based. So at that point, they're not messing with your hormones, and they can give you different factors like healing or libido enhancement. We've got a tanning one, melatonin 2, melanotan. So, at that point, there's a lot of different things and a lot of different options for you guys out there. So just be on the lookout, and we will definitely have it. Can't wait for my stuff to arrive. Oh, yeah, Jim Rat's getting his stuff. That's awesome. How you doing, man? All right, that's a plus. The new supplement is going to be a great package. Yes, Ricky, we definitely got a lot of good feedback from the PT 141 Cupid's Candy. So if you guys don't know, libido enhancers for male and female. We service both, male and female. So let's get to that. Guys, if you guys don't know, Memorial Day special all this week, all the way until Monday. And at that point, Monday it ends. So it's for blood work. And this is for everyone. So if you're a new patient, you're not a patient, you're a male, you're a female, you're going to get a discount. All you have to say is Memorial Day special. Blood work, Memorial Day special, I want it. That's all I want. Call or text. 727-389-3220. The mail panel is going from $200 down to $130. You can get this for $130. Take the savings. The blood tests on there are very, very in-depth. I guarantee apples to apples, we beat any testing in the country, and you're going to get a lot more bang for your buck as far as the labs. So at that point, check it out. $130 for guys. Females, from $300 down to $200. Now, I just had a girl write, why do girls always got to be more expensive? Well, there's more lab testing in the female panel. So at that point, that's why it's a little bit more expensive. But we're going to cater to you males and females anywhere in the country, right? You're going to be able to go to this lab in your zip code. And at that point, they're going to draw your labs. We're going to get the results expedited to us and be able to call you and give the results or transfer them over to you. So at that point, and if you need medical attention as far as maybe a therapy that could help in your blood results, then we can provide that to you too. So it could be an all-in-one package, or it could be you just want to get your hormones tested or seeing where things at. And these blood tests cover liver, kidneys, electrolytes, prostate for males, full thyroid panel for male and female, T3, T4, TSH, estradiol, progesterone, free and total testosterone, B12, IGF-1 levels. What are IGF-1 levels, John? Insulin-like growth factor 1. This is what gets produced in the liver from growth hormone. This is what you want. This is the benefits, right? Well, at least you should see where you're at before you want treatment or say you want some sort of treatment, right? There could be something off. For females, there's a little bit more testing, such as total estrogens, DHEA. So we want to check these other things in you females because it's a little bit more complicated and a little bit more in depth. So at that point, we want to make sure that we're covering all the bases with you guys. We can also do other blood tests right on top of this. Food sensitivity testing. So maybe you're on a special diet. Maybe you want to change over to a special diet. And you want to see if your body's going to react right with these foods. Well, you can actually test this through blood, like potatoes, white rice, beef, poultry, a lot of different things. I mean, it's a huge list. At that point, you can blood test, see if you have any reactions to these things as far as that goes, and you can take that out of your diet to make sure that there's no bloating or allergic reaction of any kind, and you guys are good. I mean, you guys can specifically, scientifically break it down and precisely know what you guys should be taking in to a degree. So that's really, really cool. STD testing. So this is nationwide. So maybe you want to check yourself. Maybe you had a bad experience. Maybe you had a fun weekend and don't remember, and you want to just make sure you're good. This is definitely a way you can do it. All MMA fighters, we do your blood testing cheaper than anybody else in the country. So I know you guys, some of you guys in these different states need to get some of these things like hepatitis panels and such done. We can help you guys out with that as well. Or you could just be a regular person that wants to get these hormones tested or does not know why you're feeling lethargic, why you're holding belly fat or fat deposits, why you feel depressed, why you just don't feel like yourself, unmotivated, libido may be down, concentration sucks. That could definitely be a hormone issue. That's like a red flag. In some of our business, like a doctor that does hormones most of the time, usually they can assess by what you're telling them symptom-wise. And at that point, you follow up with a blood test and your initial patient paperwork. That will tell us your family history, your current health history, and what surgeries possibly been done, procedures possibly done. At that point, we know more in depth. The labs will show us the numbers. Our doctors don't treat by numbers. So at that point, they're going to assess the numbers. They're going to assess what's going on with you in the visit. They're going to assess your new patient paperwork. And the problem is that when you go into your general practitioner or regular doctor, they don't want to run some of these tests on you. And they're telling you, we're going to run a full panel on you. We're going to run an in-depth panel on you. They send you in for blood work. You don't know what all those lab tests include or those 3 lab tests that they write on there. And at that point, you're having blind faith. You're going in there, trusting the physician is going to cover all these things to make sure that you are right, that your body's running optimally and healthily, and you're putting your life in their hands pretty much to a certain extent. And at that point, you're trusting them. Then when the blood comes back, see what you got to do is you got to book your appointment. You need to go in, sit there, and you might sit there for 45 minutes, an hour. I hear that complaint all the time. Why do I have to go to the doctor's appointment at 3 o'clock when they're not going to see me till 4? I mean, it happens to, 90% of the public. I guarantee it. If you're going there on insurance and you're going to a regular general practitioner or a specialist, you're sitting in there, so you get roomed, you're sitting there 15, 20 minutes, and then the nurse works you up, takes your vitals and stuff like that. And then finally, after waiting there, the doctor or nurse practitioner or physician's assistant walks in, depending on who you get. Now, you should get the doctor or nurse practitioner, but you might get a physician's assistant. And at that point, they're going to ask you kind of what's going on. You're going to tell them what's broke per se, like what's wrong, like I have a cough, or my knee hurts, or doc, I don't feel good, I feel depressed, I feel down. And at that point, they're going to try to assess the problem very quickly because they have to see a number of different patients to do the billing for insurance. And at that point, they're going to assess you with some issue or diagnosis and try to treat the problem with some sort of medication. Whether it be depression, it might give you an antidepressant. Whether it be a libido problem, it might be an ED medication like Viagra, Cialis, or something else. And you're not getting the problem or the root cause treated. So at that point, the blood test will be able to assess that and kind of show you. Because we know depression, at that point, it's huge these days. A lot of people are depressed. Suicide is on the rise. And it's in a number of different numbers. I was seeing even kids up to 11 years old. I mean, when I even think about kids committing suicide, it's in this day and age, it's nuts. But hormones can definitely signal these problems. So at that point, just get checked out before you take any medications like that, or before you think that there's a problem that you can't fix. Make sure you're getting it tested, or going to somebody that's going to at least hear your problems out.
You got tons of
Thank you guys, man. Absolutely, I want to find out. You definitely want to find out what's going on. You got your blood test. We do not prescribe HGH. Okay, so human growth hormone is HGH, human growth hormone, right? And it's highly regulated by the DEA. And what it's supposed to be prescribed for is like dwarfism, adult growth hormone deficiency, which there's blood testing and stuff like that can show us. There's also, kids have growth hormone deficiencies as well, and they give it to kids. So at that point, that's kind of what it's used for. It's not supposed to be for sports medicine. It's not supposed to be for recovery. It's not supposed to be for anti-aging. And the DEA looks down on these things. So at that point, there are some different options. Now, you go back to peptides, GHRH, which are growth hormone-releasing hormones, like amprelin, which is a GHRP, growth hormone-releasing peptide. Also, with these GHRHs, like we've got Semerelin and we've got CJC 1295. So I got the question the other day, what's better, John? Should I take the Semerelin or the CJC 1295? So Semerelin was developed, and it was developed before CJC 1295. It was used more, and at that point, they had the issues and the studies done on it. So it worked. Now, CJC 1295 comes along, and it's a lot better. Why? Because it stays in your body a lot longer. So that means it's going to work a lot longer and should work a lot better for you. Now, paired with the amprelin, which GHRP2 and GHRP6 used to be paired with Semerelin, it's better as far as GHRPs, and GHRP2 and GHRP6 are probably going to be no longer on the market as far as for pharmacies, for prescribed medications. So at that point, it works a lot better. It's going to be viable for you guys to use, and it should work on posterior and anterior of the pituitary to be able to stimulate your own growth hormone. So you're not putting any exogenous growth hormone in your body to possibly shut down your pituitary. Because if you do shut down your pituitary and it's not producing like it should, that will affect you in a number of different ways. Look up low IGF-1 levels and see the symptoms that are attached to that. And those are symptoms you don't want to go through. They're not going to kill you, but your quality of life will surely be affected. Hormones definitely affect the quality of life and definitely affect different things that we do and our body has done for us. All right, so let's look at some of these questions on here.
Let's answer this one that's highlighted.
Joy Snyder, am I a doctor? So I am not a doctor, Joy. I am the owner of Type Medical Center. I've worked with doctors, athletes, celebrities, regular people in this clinic for over 7 years. At that point, side by side, looked at the blood tests with them, seeing how the workups were. I know these therapies like the back of my hand. I developed some of these therapies, like the amino acids, injectable vitamin blends, with doctors, pharmacists, and chemists. So at that point, that's what I am. I am here to just educate and push out the information. Patients will see the physicians and medical providers, and they will do the prescribing, not me. You'll never talk to me on the phone and hear me prescribe or tell you what you need. No. And if somebody's telling you that from another clinic or wherever, then you definitely have a problem. It's a red flag. You want to see the doctor. You should be able to pick out the doctor or your medical provider in a crowd, in a group of people. You say, that's the person that prescribed my medication. That's the patient relationship, doctor relationship, or medical provider relationship I have. And at that point, If you're not seeing this medical provider or doctor, or you're just talking to somebody on the phone, that's an issue, guys. So at that point, you should definitely assess, because it's your health, all right? You should assess what's going on. So I hope that answered that question. So what else we got? Angela, I love you. Angela Trulson and her amazing husband, I love them both. They're great great girls and guys. So I love you guys. I appreciate it. All right, so Craig's on here, my man. So Craig Brodsky too. Craig Brodsky, he is working really early mornings. I've been following you, Craig, but he got to hit the gym the other day, so I'm really happy for you. All right, yes, we have melanotan. Yeah, we don't really use or push out the melanotan too. Now, it's a peptide that will help your skin, tan, basically, in whatever color it is. So at that point, the only bad thing with melanotan. Now, all of these therapies and peptides and stuff like that, I will usually try, Sharice will, some of the staff here, so we can tell the doctor our experience with it. Even some of the patients that have been with us for a long time that want to try some of these new different peptides or maybe have some experience with them, they want to try it. So we get all these experiences. Like for me, I'm telling you, it worked great. I mean, I get a tan pretty easy or stuff like that by the sun, but without the sun and with like maybe a day out there or maybe a couple hours, it worked really well. And it worked fast. I mean, within a week. It was good for libido, too, the erections. Now, the PT-141, that's like the cutout point of that, and that's all that's used for. But it does have a libido effect, too. But the only bad thing, and this is my personal experience, and I'm always going to tell you guys straight, I don't care, is that the brown spots on my body. So if you have any moles or brown spots, like I have a couple little brown spots, right? They did get darker and a little bit bigger. And for me, I was not about that. Like I had a little nose, like a little mole on my face or whatever it was. And Sharice started saying, man, it looks like it's getting a little bigger. I'm like, I'm done. I'm out. I'm stopping right now. At that point, it did go back down, thank God. But that was my only thing. So, yeah, we do have it. Would I recommend it? I would definitely tell somebody, hey, listen, if you have experience with it, then you might be okay. But, it could cause this effect. And that's what it's all about. The medical provider should be telling you pros and cons, because with any medication or anything you do, there's always an upside and there could possibly always be a downside. So make sure you're always informed. When doing TRT, what do you add to prevent hair loss or add for hair growth assistance? This is a really good one. Image, that was a really good comment and a really good question. So let's address this. This is a big one. So when you start HRT or TRT, what can you do to prevent hair loss? And what can you do for hair growth assistance? So with testosterone replacement therapy. Now, it doesn't matter if you are on testosterone or not on testosterone. It kind of goes by your genetics. So there's people that have it in their family and they have balding in their family, and it just is what it is. Now, when you go on HRT, this could possibly speed it up. That means you get thinner faster. If your DHT levels are very high or extreme, you can lose like your front a little bit faster and stuff like that. It's a double-edged sword per se, because you want your DHT levels to be on the rise with your free testosterone. And you want your total to be good too. So at that point, when you have that, your body's feeling great, you feel awesome and stuff like that. Now, if you're predisposed to balding, it could, like I said, expedite that or speed that up. So at that point, you really got to choose what you want. Now, can there be some medications out there to help you with this? Yes, there is. Now, one has a double-edged sword, and this is the most commonly prescribed one for hair loss as far as medications goes, and that's finasteride. Finasteride is the number one commonly prescribed medication for hair loss, FDA approved. It has the studies. And usually the studies say even the 1 milligram to 5 milligrams, they both had the same outcome almost. So at that point, it really, I would, as far as go with your physician's, recommendation. For me, I did try the medication. It was 1 milligram. I tried the 1 milligram. It goes in your system. It stays in your system for some time. You'll see your DHT levels start dropping through blood tests. Along with that, your free may drop a little bit. Now, it was all good, I guess. Now, I didn't notice like me keeping a whole bunch of hair or anything like that. I wanted to be preventative. The big thing that knocked it out for me, and I do not ever want to take the medication, was when I took the medication, it specifically affected the libido portion. Now, this is how bad it affected me. Usually, and if you guys know my wife, Therese, we've been married 11 years. And for those 11 years, we've had relations almost every night. Let's put it that way. So at that point, when I was taking this medication, after about, I would say a month and a half, and I'm on testosterone replacement therapy, okay? I'm optimized in every way, shape, or form. Estrogen's perfect. Everything's on point. So at that point, you know, she'd walk past and like, I would think in my mind, it's been a couple days, right? And I'm just watching TV or whatever. She could be in the most hottest thing, your dream girl, and it's just not there. It's gone. It's the drive, the oomph, like you're not even thinking about it, which is not cool. When you're on testosterone replacement therapy or hormone replacement therapy, you should be like Superman. Whether it's a girl, guy, or whatever your pleasure is, that's what it should be. You shouldn't, you know, not be thinking about sex or having pleasure in some way, shape, or form, and something you used to like to do that everybody pretty much likes to do at that point, I would think, even if they're asexual or whatever it is. So that was the thing. So they call it the male castration drug. I would highly advise not taking it. It's just me. But if you want to take it, that's on you. If your doctor thinks you should take it, then you should definitely take it. It does have a couple of different other pros to it. As far as you know, it could be helpful, I guess, if you don't want to have libido. That's it, really. So the other medications that are out there that can help. Well, there's a really common one, minoxidil. That's like Rogaine. It's a foam. You can buy that at any grocery store, Walgreens, whatever it may be. You can put that in your hair. It does help as far as that goes, as far as a preventative, and will help you hopefully keep your hair. Now, we've developed something, we've had this for our patients for a long time. We've got a combination, which is a foam, that has finasteride, but it's not orally, so you're not taking it in, so you shouldn't be absorbing it as much. So at that point, finasteride, it has minoxidil, which is the Rogaine, but it has a higher percentage, and it also has Lantropost. So if you don't know what Lantropost is the cousin of Latisse. If you haven't heard of Latisse, ask maybe one of ask your girlfriend or wife or one of her friends. They possibly know what it is. That's what they used to put on their eyelashes, or still do, to help grow and thicken the eyelashes. So Lantropost is there to help thicken the hair. So you've got finasteride to help you keep it, the minoxidil to help you hopefully grow, and you actually have the Lantropost to hopefully help you thicken the hair. So at that point, you're doing a preventative there. So that's the best preventative that I think that's out there. I've seen a lot of different things. I've seen these hymns. Don't go for that. Go for something prescribed if you're going to do it, or the minoxidil route. I think that's the best way. Some of the shampoos out there have DHT blockers in there and stuff like that. I would definitely look into that. Our hair health capsules have a lot of DHT blockers, and that's what I currently take now. And I've definitely noticed, you know, a good significance of my hair staying. Instead of looking down and you're seeing like little guys on the floor, and you're like, oh no, I'm losing hair. You don't want to do that. So at that point, look into these things. Hair health capsules, our hair foam, if you're looking at that, or if you don't want to go that route and you're looking for a more cheaper route or something you just pick up right away, minoxidil, and there's some shampoos out there. I can actually bring in some of the shampoos. I use some of the shampoos. At that point, I'm always trying to be preventative. I'm always looking for the best for myself, and I always want to share that stuff with you guys, so you guys are getting good information, and I'm reviewing it hardcore. If I tell you guys it's good or it's going to work, I vetted it. I've used it, and I'm pretty brutal on some of the things that I have. So at that point, it's going to go through some destruction before I tell you it's going to work properly, all right? All right, so that does the hair growth, and I'll go back to Facebook and try to get his... Yep, so Image, he's messed with finasteride, messed with his libido too. Can't have that, man. For sure. To get on TRT, what do they check for? All right, so to get on hormone replacement therapy, what we're going to do is we're going to check for, we're going to go through the blood panel. So the blood panel is going to consist of liver, kidneys, electrolytes, prostate, full thyroid, free and total testosterone, estradiol, progesterone, lipid panel, which is your cholesterol panel, IGF-1, we're going to do B12 on there. We're going to really, really see what's going on. And at that point, with that and your new patient paperwork, as long as there's nothing like crazy as far as health history, like no open heart surgeries or such, then the doctor's going to probably get on with you, and probably we're going to be able to help you out. So at that point, it's very simple, very easy. All you got to do is call or text 727-389-3220. We can get you set up for blood work nationwide, or we can help you out with just our vitamin amino acid injectable therapies. or just our ECAs. No blood work is needed for these things. I get that question all the time. Hey, John, do I need blood work for the Hercules potion or the vitamin amino acid blends? No. Fill out the new patient paperwork, get it back to us. We'll get you on with a medical provider. At that point, go over some of the things with you, answer your questions. It'll be on your time. And at that point, we can get you hooked up with those therapies and get you feeling right or performing better or whatever it may be. So please look into these things. All right. So Craig, my man's all in. So melanotan. I know you're all in for that. Casey will try anything. I bet you he will. Yeah, the melanotan. See, that's the other thing. So melanotan or the PT-1841 usually is supposed to cause nausea. The blends that we've had and stuff like that, Craig, we have not had any nausea. I don't need a tan. I'm African black. All right, Joey. You don't need a tan. That's fine. The PT-141 will help libido, though. Does Titan Medical compound these peptides? Is there a price list of you? So Lisa Mitchell asked, does Titan Medical Center compound these peptides? Great question. I did say it in the beginning, but I'll tell you guys again. So Titan Medical Center is Titan Medical Center. We don't own a pharmacy. We don't compound any medications here. We don't hold medications here. We don't do anything as far as that goes here. What we do is we see you, we help you out. We have the doctors here. They'll make the recommendations. As far as that goes, we use third-party vendors. LabCorp, Quest, labs in your area, right? For our vendors, they're U.S. licensed compounding pharmacies or pharmacies. So at that point, we don't have any hand in them. We don't compound them. We get them from them and get them to you guys from the pharmacy directly to you guys. And that's all we do. So we do not compound them. All right? All right. Bald men are sexy. I know, all right, Angela? That's what I was telling Charisse. I told her, oh, and prostate. I said prostate. Is there any issues with stopping TRT? All right, so I get this question a lot too. Is TRT or hormone replacement therapy a lifelong commitment? So that's a question, you really got to ask yourself. This is the thing about it. If you come back and you're low on testosterone, you're feeling some types of ways. Symptomatic in a couple different ways, probably, right? Whether libido, energy, motivation, whatever it may be. So when you go on that testosterone replacement therapy or hormone replacement therapy, you might get those feelings back. The shade comes up, you're feeling like $1 million and back to where you were, right? Now, you decide for some reason or something happens that you need to get off hormone replacement therapy or testosterone replacement therapy. What do? At that point, you don't want to crash your levels, and just stopping cold turkey is going to crash your levels, and it's going to crash them quick. And at that point, you're going to feel like you used to, or even worse, because you haven't felt like that probably in a while, so going back to that's going to make you feel bad. Now, that is the thing. So when you stop TRT, Dave, you might go back to the way you used to feel. We also know that over years, you're going to lose more testosterone naturally, even without TRT or being on TRT. So your levels might come back even lower. And then what happens is your body is gone and it's trying to reboot its system back. Now, with Titan Medical Center, if you need to get off hormone replacement therapy or TRT that we're prescribing to you, at that point what happens is there is a protocol from our doctors and medical providers that will help you get off properly. And at that point, it won't crash you down. And at least you won't be feeling horrible like you would if you just crash your levels and stop cold turkey. So if you're going to get off HRT or TRT, make sure you're doing it properly and make sure somebody's monitoring you. And at that point, you can feel not as bad maybe, okay? All right. Scalp care. Also, our water here is extremely harsh. I got crazy mineral buildup. Keeping my scalp healthy and using biotin has helped me so much. Yeah, so there's a couple different things out there that will help, Angela. The hair health capsules I think are really, really good for hair. I know all the girls rave about them here. I take them too, so they're really, really cool. That might be a way. Shampoos too. Different shampoos for sure. Do you have to complete the new patient paper for labs? No. So for lab work, you do not have to complete the new patient paperwork. If you want to get labs done right away, you want to get results right away, you want to get on the schedule right away, get your lab work done first. Call or text 727-389-3220. See, I said, all you got to say is, I see John, Time Talk Tuesday, Memorial Day Blood Special. I want it, please. If you're male or female, they're going to get you hooked up. They're going to get you all your paperwork, information to get you in the lab, to get your blood results drawn. Jeez, guys, it's been crazy for me today. Oh, no problem, Dave. No problem at all. Lisa, no problem. I'll be reaching out for more information. Dave, you're 52, man. Gotcha. All right, cool. All right, guys. I think that has been a pretty good Titan Talk so far. All right, so gym events. We've got gym events going on every week. We've got LA Fitness. We've got crunches. We're all over the place. Titan is definitely trying to take over as much as possible. Otherwise, we're going to be doing a giveaway too. I'm going to be giving away the Titan Strong, the new Titan Strong shirts. So you guys can see them real quick. Got the awesome TNA logo on the side too. Really cool. You know, man, J. Crew got this up. And then, gotta have the loyalty on the back, right? Boom. So I'm gonna give away these at the end, right? I'm gonna have you guys text in. But I got a couple more things. So, on the newsletter, if you guys are getting the newsletter, we asked a poll question. What kind of music motivates you? Now, we got back rock, rap, and what was the third one?
It was, putting it up, it was
rock,
EDM house.
Okay, EDM house. Okay. So, which one do you guys think won? Da-da-da. It was rock and roll. So rock and roll won. Rock and roll beat out rap and EDM. At that point, my rockers out there, what are your playlists? Let me know what those playlists are. I might add some of those songs, mention you out, shout you out, or maybe even share that playlist with the group or the Titans. We want some good music to work out with, right? Now, me, myself, I like all types of music. I like rock, rap, EDM, jazz. I'm not really a country guy. Sorry, guys. That's just me. And, I grew up around horses and all that stuff, so I know about it. But it's just not me. So at that point, everybody's got their thing, I guess.
There's two others.
Yeah, there's two others?
You get classical, I guess.
Oh, classical's another good one. I guess, at that point, I'm so old, 38, I guess when I was coming up was classical, right? or Rat or Slaughter or any of that, metal's definitely where it's at for me, too. I definitely like metal. But I like rap. I like, EDM. But in the gym, yeah, even Art knows. He drives in my car. I have the exact same playlist. It's Metallica.
90s.
It's BYOB. It's System of the Down. I mean, there's definitely some good rocks in there. So at that point, let me know what you guys' playlists are. Share it with your boy, all right? What else we got?
Other question.
Okay. Have you ever been injured or hurt doing something you enjoy? So you could be riding on a motorcycle and something happens, right? Or you could have been in a bad accident. Or you could have been, I don't know, climb up the playground to get your kid and fall down, right? At that point, what have you done to help heal yourself? Think about some of these things that you've done and some of these things you've tried. And what's been the worst case and what's been the least case? And how long is it taking you to really heal? That's what I really want to bring up to you guys, because there's a lot of people that injure themselves doing a lot of really simple things or things they like to do. And one thing is, like me, if I hurt myself working out, that's something I like to do. So what do I do to help heal myself faster? Because I want to get back in the gym, or you want to get back to the activity, right? Now that's where I want to bring up the BPC 157 or 500. But let's bring up BPC 157. So at that point, you want to help bring the blood flow to the area, and BPC 157 is great for helping the healing process. So if you guys are looking to help heal faster, if you guys have an injury, I'm pretty sure BPC 157 is going to be a great match for you. Now, how do you take BPC 157? Now, BPC 157 is taken two different ways. It's taken orally, which is great for the stomach, but the absorbency isn't really... Now, injectable. Now, injectable, they usually have you do subcutaneous in the stomach area. Now, you can inject it subcutaneous like me. I do it in shoulder, and I actually do it around the patient. So there's a couple different ways you can take it and stuff like that. Now, when you become a patient and you get this recommended to you, we will go through everything with you on how to inject it, how to mix it, what the proper procedure and protocols are, and all that great stuff. So I'm going to end it on that note. I appreciate you guys. It's been 40 minutes. Usually I only go for 30. I don't want to bore you guys too much. If you guys have any questions, concerns, email us, DM us, check the newsletter out, play with the poll or be active with the poll so we have these answers and I'll bring them up. If you guys have questions that you want me to bring up on here, DM them to me, man. I'll answer them to the best of my ability. You guys can tune in. I want to definitely give away the shirt. Make sure you guys are following us on social media. I'm going to do a blood work giveaway too. And at that point, you guys are going to have to share the post with a couple entered in that. So, Who wants the new Titan Strong V-necks? These are awesome material, guys. Awesome. These things were wild. They're selling like crazy. And at that point, I ordered a lot more. So we're going to flood. And I definitely want you to take a picture with it and post to your social media and tag us, right? So what we're going to do is hashtag Titan Strong. What I want you guys to do is text a line, 727-389-3220. Hashtag Titan Strong, right? And then I will give away the gift certificate, the $100 gift certificate. Hashtag Titan Gift. Text it to 727-389-3220. All right, guys, I'm going to leave you with this. Facebook, Instagram, keep it locked. Please, if you're on YouTube or you're not on YouTube, go there and subscribe to the Titans channel page. Share that. Getting a lot of the information. It's got the full videos. Sharice's soapboxes are on there. A lot of funny things and a lot of great things, plus tutorials. At that point, I hope you guys love the shirts. We've got a lot of new Titan gear coming at you guys and a lot of surprises. So keep it locked to Titan Medical Center. I appreciate all you guys being on here, all the support. We love you guys. Thank you. And this is another Time Talk Tuesday done. Appreciate it, guys.